Hey Sarah, it's Nick. Could you buzz me in? My name is Nick Gardner, and I'm a pediatric home nurse, and today I'm here to take care of one of my 2-year-old patients, Elsa. When you get hired to PHS, they do a bunch of training at the facility, and then you come in the home and you do a few shifts of both day and night. So they put you with a nurse trainer or preceptor before we actually come in and work in the home on our own. One thing about home care nursing is that every day presents new challenges. So let's see what Elsa has in store for us today. Elsa's on a ventilator, and she's got a heater pot to keep the air she breathes nice and warm. She's on an oximeter for monitoring, and then feeding pumps as well. We go through training on how to work all those machines, how to troubleshoot them if something goes wrong. So Elsa has 8 o'clock meds, and because she has a feeding pump, she has a line into her stomach and her intestines. So we give feeds through there and we give meds through there. So I already checked her meds against her medical record to make sure I'm giving the right ones. So she's got several issues, cardiac and respiratory. So these meds will help her with those. So Elsa also has an 8 o'clock vest because some of her meds are aerosol and then they go down into her lungs. So we'll just get those set up. Hospital nursing is different than home care nursing because with home care nursing, you only have the one patient that you're working with at a time, and you really have to be in tune with all their equipment. You're really responsible for everything related to Elsa. You get very comfortable in the home very quickly. You know, being in somebody else's home might not be the most comfortable at first, but as you're there and you realize they want you there, taking care of their children, and how important that is to them and the family to be there rather than a hospital, it really becomes just second nature to you. The majority of Elsa's day is spent out here in the living room, scooting around and playing.
Having a nurse in the home does allow for me to be a parent, to be allowed a chance to get a night's rest. I know that I have good people here taking care of Elsa, and that's always a good peace of mind for me and for Brent.
Being at home, I get to tuck Elsa in at night. I get to play with her right up. I get to help with her cares before she goes to bed, all of that stuff, instead of us having to go our separate ways at the end of the day.
When she came home, she showed new strength. I think the relaxed environment of being at home really helped her thrive. She's just grown to become so strong. She's sitting up on her own. She recently started to stand. She's just getting very strong at home.
We put her AFOs on that are little leg and ankle and foot braces. These braces help to give her that support that she needs in her legs and her ankles to be able to stand. Go up. Go 1, 2, 3.
Should we go up? And she's pushing off with her hands. She'll do that, and then she'll pull herself. So those will work on her arm strength, and then standing here, and then the motion of going up and down helps with her legs. The skills are definitely transferable. Because you work with every aspect of each patient's care, you can really go into any job and do the things that you need to do. I would say that home care nurses are some of the best nurses around and are able to do well in every position. There's definite growth that you see in home care, and that might be my favorite part about it. You don't see a patient for a day or two and then leave and then not know what happened to them. You get to see them grow and get better. The reward you get out of seeing them grow and the happiness you bring to them and the family is unmeasurable. So, yeah.
They're coming into our home to take care of our special person, and that gives me a lot of peace of mind knowing that there's somebody that loves my child. Without home nursing, we'd still be stuck in a hospital, and so I'm very grateful for the care that they provide. I couldn't imagine the journey without them.